My name's Dr. Richard Pan. I'm a pediatrician and the state senator, and I'm very pleased to be joined here today by medical, public health, and community leaders in Los Angeles today. And we are here to remind the people of California of the cost of preventable disease and to say that we want the choice and the right for our children and our families to be safe in our own schools and our community. Prior to vaccination, measles infected millions in our country every year, with 40,000 hospitalized and 400 to 500 people died, and thousands more survived with permanent disabilities. And with great effort after the development of a safe and effective vaccine, we eliminated measles from the United States in 2000, 19 years ago. And fortunately, parents no longer have to experience the fear of watching their child suffer from a very contagious and very serious disease. Unfortunately, about the same time as we eliminated measles, a discredited physician in England falsely claimed that measles cause autism. And although numerous studies disproved this claim, and his research was proved to be a fraud, the damage was done. And we had anxious, misinformed parents who avoided vaccinating their children, many of whom are now college age today. So here we are at UCLA, a campus that was recently disrupted by measles. Our country is experiencing the greatest number of Americans infected with measles in the past 25 years. In fact, even before the elimination of measles in 2000. And here in California, we've had 44 Californians infected this year so far. Now, measles is contagious, actually about 4 days prior to symptoms. So each case of measles can have hundreds or even thousands of contacts, people exposed. And if exposed, an unvaccinated person has a 90% chance of being infected. And in fact, measles remains airborne 2 hours after an infected person leaves a place. So even after a person is gone, they can still infect someone 2 hours later. And that's why when a person with measles, infected with measles, came to UCLA and there was also at California State University, LA, the public health department ordered a quarantine initially of over 1,000 students, staff, and faculty who came in contact with that measles patient until they could prove their immunity by vaccination. This step was necessary to prevent further spread of the disease, which would have been more disruptive to both campuses and to Los Angeles. Now, these outbreaks are costly also to taxpayers, because each case of measles requires extensive effort by public health workers to identify potentially infected people to prevent further spread of this disease. Even in cases where, in a jurisdiction where there's no actual cases of measles, just the potential exposure creates additional work for public health departments. And it is hard to actually track the true cost of an outbreak to a local health department, especially since during the outbreak, the priority is stopping the disease, not bookkeeping. However, during an outbreak, public health staff have numerous things they have to do. They have to follow up with people who are potentially exposed. They have to check their immunization records, and especially with adults, those can be a little hard to find. They perform blood tests to test for immunity. They may have to issue isolation and quarantine orders, administer post-exposure prophylactic medication to help prevent that person from catching disease and spreading it. Of course, then educating the public and then communicating with all of you, the press, about what is going on. And while the cost of the measles case affecting the college's campuses here have not yet been determined, here in Los Angeles, the cost associated with containing just 3 measles exposures related to travel at LAX, actually I flew in there this morning, earlier this year, have already cost county taxpayers more than $80,000 for those 3 cases. Now, the cost of measles here in California has already exceeded several $100,000, and I'm sure once we're able to tally up additional costs, it's going to be much higher. Now, thankfully, this year in California, we have not suffered any large outbreaks like New York or Washington State or Michigan, or even like the one we had back in 2015 that started in Disneyland. That's because in 2015, we took action. We took action by passing SB 277, which actually increased the vaccination rate among children entering kindergarten to above 95%, which restores community immunity. But I would also want to recognize that SB 277 does not require unvaccinated students who are now in high school or college to get vaccinated. And unfortunately, this law is now being undermined by a small handful of unethical doctors that are putting children at risk for disease while profiting from selling inappropriate medical exemptions to misinformed parents. And the lack of community immunity at schools with students granted inappropriate medical exemptions is contributing to the spread of preventable disease such as measles. In fact, last spring, we had a measles outbreak in the Bay Area that was actually further spread to additional people by infected, unvaccinated children who received suspect medical exemptions. In addition, after passage of SB 277, we witnessed physicians who advertised exemptions for cash on social media and their internet. And parents would even post on social media that their child's own physician had refused them a medical exemption because they did not qualify. So they went and they found one of these physicians and they bought one. An investigation by the Voice of San Diego reviewing medical exemptions submitted to the San Diego Unified School District showed that one physician who was advertising medical exemptions on her website issued almost a third of all the medical exemptions in that school district, and that numerous other exemptions were granted by physicians who are on probation with the medical board or clearly did not regularly provide care for children. Now, why should we worry about this? Well, the result of these fake medical exemptions involved a tripling in the number of medical exemptions in the state, but more concerningly, as initially reported by the Los Angeles Times, we have individual schools. There are schools with medical exemption rates above 20% and even as high as 50%, meaning that the students at these schools are at risk for a major outbreak. We here in California cannot allow a handful of unscrupulous physicians to put our children in danger, particularly babies who are too young to be vaccinated, children who genuinely need a medical exemption. The ones who actually need them need that protection. And that is why the California Medical Association and the California American Academy of Pediatrics are sponsoring SB 276 along with the Parents of Vaccinate California, because physicians are holding themselves and their colleagues responsible to practice quality care based on science and to keep the public safe. I would also like to thank the Los Angeles County Board of Supervisors who recently voted to support SB 276. And Los Angeles has already experienced this year firsthand the cost of measles to individuals and community. In addition, I would like to also mention that just yesterday, a study from Johns Hopkins was published in the journal Lancet Infectious Disease, which identified the 25 top counties that are at risk of a measles outbreak, and Los Angeles came in at number 2. That's based on looking at international air travel, the rate of non-medical exemptions to vaccinations. I would note that we did get rid of those in 277, but it's only been in effect for 2 years. Population data and reported measles infections. So we need to be sure we keep the public safe. We need to be sure people here in Los Angeles have the freedom to go about their community and be able to go attend college and not worry about being exposed to a serious disease. So I'm proud to be here today with a broad coalition joined together to underscore the economic and human burden associated with the disease that should be eradicated if it was not for actively promoted misinformation. So I'm now pleased to introduce Dr. Jan King, the Regional Health Officer for West and South Los Angeles, who will speak firsthand about the work and the effort that goes into controlling the spread of measles and other communicable diseases. So thank you so much, and thank you, Dr. King.
So good afternoon. My name is Dr. Jan King, and I am the Regional Health Director for West and South Los Angeles. Today, I'm briefly going to talk about the outbreak that has impacted Los Angeles County and then share with you some of the things that we do at the Department of Public Health for Los Angeles County to prevent or to mitigate outbreaks. So measles is a highly contagious disease, and it has significant morbidity. If you have approximately 1,000 children,
there's an emergency right there. There we go.
hopefully not, because
Hopefully
I'll
not.
be very busy this weekend. So measles is highly contagious, and it contributes to a lot of morbidity. If you have approximately 1,000 children who are diagnosed or contract measles, approximately 1 to 2 of them will die. Fortunately, due to the widespread availability of measles vaccines, as well as really strong public policy, we've seen a significant decrease in measles cases over the last 60 years. But despite these efforts, persons living in Los Angeles County are increasingly at risk of being exposed to measles. And this is because there are increasing rates of measles in other parts of the world. We have international and domestic traveling, and then we have pockets of individuals here in Los Angeles County who are not immunized or who are under-immunized. And what's illustrated currently with this current outbreak is that one infectious case can expose hundreds, if not thousands, of individuals to measles or other infectious diseases. For example, on this campus, UCLA had one individual who was diagnosed with measles. Within a short period of time, that person exposed over 850 individuals to measles. And that triggered a huge response, which was very time-consuming as well as very costly, not only to the university, the Department of Public Health, and other private and public agencies. So what do we do in public health when we have a contagious disease? So when we mount a response, first we have to figure out if the case is actually a case. So we need to interview, we need to do additional blood tests, and then we have to isolate that case. The next part, it gets kind of hard. We have to create a line listing of every person that they've been exposed to. So this may mean every location they've gone to, from a grocery store to medical establishments to emergency rooms. And we need to figure out everyone who is in the same space with them. We need to document exposure. We need to document whether the exposed people actually have immunizations against a particular disease. And then, if we're within a short period of time, we can actually give medical therapy, we can give immunizations, and sometimes other medication to prevent the onset of a particular disease. And then over time, we need to follow these individuals to ensure that they do not become sick and they do not transmit to other people. So it's timely and it's costly. The cost of an outbreak includes staff salaries, a lot of overtime, medications, transportation, laboratory tests, as well as other things. In the past 4 weeks, we've investigated 8 cases of measles that have exposed more than 3,000 people to measles. We estimate that between $1,000 and $2,000 are required for us to investigate one exposure to measles. So you can see that over time, we can quickly run up a bill that gets into several millions of dollars. This is very costly to taxpayers. So in the end, measles is a preventable disease. If we have higher rates of immunizations, we can further reduce this disease within our borders of this county, and we can lessen the financial impact that we're seeing due to outbreak investigations related to vaccine-preventable diseases. So today, we stand in support of Senator Pan, who is sponsoring this bill, SB 276. And if this bill does pass, we'll have stronger tools whereby we can enforce immunizations and prevent vaccine-preventable diseases. Thank you.
Thank you so much, Dr. King. Next, we have Dr. Cy Roy, who's, I believe, president-elect of the LA County Medical Association, as well as being a trustee of the California Medical Association.
Thank you, Dr. Pan, and thank you all for being here for such an important topic. I represent the LA County Medical Association and the California Medical Association, a group of physicians that is ethnically and geographically diverse. I represent all physicians from all practice modalities and all specialties. Like many other parts of the county, Los Angeles has seen an alarming rise in diagnosed cases of measles in the recent months. Already this year, we've seen 14 confirmed cases, with new reported cases emerging constantly. The physicians of the LA County Medical Association and the 44,000 physicians of the California Medical Association want to send a clear message that we support SB 276 and the idea that physicians should be held accountable to serve their patients and their community to better protect public health and community immunity. This is not about taking medical control away from physicians. It is about creating safeguards to ensure that rogue doctors cannot easily practice outside the accepted standard of care. Thank you.
Thank you so much, Dr. Roy. Next up, we have Erin Richardson, a parent who has a child who would be at risk because of the spread of measles. Thank you.
Hi, my name's Erin Richardson. I'm a mother of an immune-compromised micropreemie. My son was born 17 weeks early. His life was in the hands of the neonatologists, the nurses, and his therapists. They handed him to me after 3 months in the hospital. And even though he was less than 5 pounds when I got him, I was put in charge of him. It's recommended that micropreemies stay isolated and out of school for 18 months to 2 years because of their compromise. He has chronic lung disease. He had 2 brain bleeds. So I tried my best to follow that. I had a great job, luckily, and a mom that helped. So he went to school at about 18 months old. And he had potential measles exposure, and that was back in 2015. We were quarantined. He was given immunoglobulin. My daughter had blood draws to prove her immunity. I had blood draws to prove my immunity, and I was terrified. I'd done everything right, and how could this happen? How could this happen to my son? Common cold or mild virus could land my baby in the hospital. What could the measles do? Luckily, I didn't have to find out. I did need to help, though. I had to stop the fear and misinformation and help my community earn immunity. So babies would be protected, immune-compromised children and adults, and those who cannot be vaccinated. That's why I stand with Dr. Pan today, and I will support measles vaccination and the stop of rogue doctors. Thank you.
Thank you. Thank you so very much, Ms. Richardson. Next up, we have Rabbi Hershey Ten, president of Bekur Home. And as a religious leader here in the community, too often people claim that religion is the reason why they are not getting vaccinated, but there's no major religion that forbids vaccination. And I know that because of the outbreaks happening in New York, have been happening in the Jewish community. Pleased to have the rabbi here speak about, as a religious leader here in Los Angeles, the importance of being vaccinated. Thank you.
Good afternoon. My name is Rabbi Hershey Ten. For upwards of 30 years, I've been president of Beker Cholim, one of the largest charities in Southern California, serving thousands of adults and children suffering from life-threatening and serious illness. In addition to our charitable work, Beker Cholim articulates a Jewish perspective on those matters that impact the individual health and that of the public at large. I would like to thank Dr. Senator Pan for his tireless legislative work on behalf of the residents of California and bringing us here together with the Los Angeles County Department of Health, who have been serving our community to keep us from harm. When the measles outbreak was first identified in Israel last October, we worked in tandem with the Department of Health in monitoring the progression from Israel to New York, to New Jersey, the Midwest, and now it has arrived in Los Angeles. Overall, the Los Angeles Jewish community has been consistently proactive on matters of immunization. In 2017, Beker Cholim created a private school immunization policy that went beyond SB 277, providing greater protection for students in private and parochial schools. As of today, and to the best of my knowledge, there has not been a case of any Jewish day school or yeshiva student diagnosed with measles. And please God, this doesn't change. For some time, the media has focused on the measles outbreak on the East Coast and specifically in the Orthodox Jewish community. However, to paraphrase the Wall Street Journal, the propaganda and paranoia that questions the safety of vaccines is not confined to any particular religious or ethnic group or bound by ideology or class. Those living in Brooklyn, Williamsburg, and Rockland County appear to be just as susceptible to anti-vaccine conspiracies as wealthy professionals living in Santa Monica or in Oregon. With that in mind, I want to emphasize, and I want to be perfectly clear, that on issues of health and public safety, decisions in Jewish law are based on the majority of expert medical opinion. In cases of measles, mumps, and rubella, the opinion held by tens of thousands of physicians is that vaccinations must be taken as prescribed and outlined by the Centers for Disease Control and Prevention. In Jewish law, there is an obligation to be vaccinated, and there is no basis that immunization should be avoided unless medically indicated. As president of Bikur Cholim, I recently asked all Los Angeles rabbis, Jewish day school and yeshiva principals, and community leaders to speak publicly out on this matter to their congregants, to their membership, to their parent bodies. Because when there is a health crisis in our city, our communities look to its leaders for guidance. As a rabbi and as a leader of a major healthcare organization, I am here to state that we emphatically support Senator Pan's SB 276 bill that will bring integrity to letters of medical exemptions. And we stand side by side with the thousands of physicians who serve our families and protect us from harm. Thank you.
Thank you so much, Rabbi Ten. I'm now pleased to introduce Dr. Alice Kuo, who is a governing board member of the American Academy of Pediatrics Chapter 2 here in Los Angeles, as well as the state, the district of the American Academy of Pediatrics. Dr. Kuo. Caught up in my own order.
I'm Alice Kuo, member of the governing board of the American Academy of Pediatrics in California, as well as president of the Southern California chapter of the AAP. And I represent over 5,000 pediatricians statewide who support Senator Richard Pan's bill, SB 276, which addresses medical exemptions for vaccinations. The AAP is extremely concerned about protecting vulnerable children from vaccine-preventable diseases such as measles and pertussis. Universal vaccination is the only way to keep these children safe. Those children who are particularly vulnerable include babies who are too young to be fully immunized and immunocompromised children who either have a primary immune deficiency or who are undergoing chemotherapy treatment for cancer. These children need the protection of those around them in order not to contract these potentially fatal diseases. We support medical exemptions and look forward to partnering with public health to keep children safe. We are concerned about physicians who provide exemptions that are not based on science and who sell exemptions at a high cost to patients. SB 276 will go a long way to strengthen herd immunity to protect all children in our communities. Thank you.
Thank you so much, Dr. Kuo. Finally, we have Dr. Valencia Walker, a pediatrician here in Los Angeles, who also serves as a member of the CMA Council on Legislation. Dr. Walker.
Good afternoon, everyone. Once again, my name is Dr. Valencia Walker. I am a pediatrician, but specifically, I specialize in the care of premature babies. So I'm a neonatologist, the type of doctor that helped take care of Aaron's little boy. I'm also the chairperson for the California Medical Association's Council on Legislation. So we represent over 44,000 physicians throughout the state of California, and we strongly support Dr. Pan and SB 276. You've heard a lot about what measles is and what measles can do. You may have heard a lot of arguments about why people have concerns for SB 276. I want to give you a very simple example of what it is designed to do. As a physician, I work with a team of people. When I figure out there's something that my patient needs, I don't just reach in my pocket and hand it to them. If a patient needs a medication, it goes to a pharmacist. The pharmacist double checks and makes sure that I have the right dose for the right patient. It comes back to the nurse. The nurse then checks it again and also makes sure that it's the right patient getting the right thing at the right time when they need it. This is what SB 276 allows us to do, to work as a team, to make sure that we are doing what's right for the patients who need it, when they need it. And as physicians, we are here to take care of our patients, our families, and our communities. And that's why we stand behind Dr. Pan and SB 276. Thank you.
Thank you, Dr. Walker. So with that, I want to thank everyone for being here, and I want to thank all the speakers, and I'd be happy to take some questions. Yes, sir. So the bill itself does not have specific punitive measures. Certainly the Medical Board of California will now have access to information that they currently don't have through the Department of Public Health if they wish to pursue physicians who may be acting unprofessionally, so they could under the unprofessional conduct. But I think more importantly, what the bill does is that because what the bill calls for is actually a review of the medical exemptions going into the future by the Department of Public Health and approval by the Department of Public Health, it actually will prevent the granting of inappropriate medical exemptions. It will basically eliminate the market for inappropriate medical exemptions. And because ultimately what we want is we want to be sure our schools are safe. The schools that have medical exemption rates above 20%, even up to 50%, we need those schools to be safe for the patients who are attending them, for the students who are attending them. And so that's really the most important goal of the bill. But certainly, it would also create opportunities, information for the medical board to be able to identify physicians who may be acting unprofessionally. Yes. Yeah. Right. So yeah, so what would happen with the bill is that what would happen is that all medical exemptions would need to be filed with the Department of Public Health, and then starting a date a couple years from now, because it'll take some time for the Department of Public Health to put this together, then the actual exemption would be a physician would apply for the exemption, and then the Department of Public Health would make a decision whether to approve it or not. And the schools would certainly be informed that they should not accept any medical exemption that was not approved by the Department of Public Health after that particular date. So I would point out that SB 276 is based on a process that actually is happening in West Virginia, which is one of the other states that is also does not have non-medical exemptions, and so this mechanism has worked very well in the state of West Virginia, and we believe that it would work equally well here in the state of California. And so this is a process by which we will ensure that children who actually need medical exemptions will still be able to get them. That's very, very important. We're not eliminating medical exemptions. We're bringing integrity back to the medical exemption system. And that's what we're going to be doing with SB 276. Right. Yeah. Well, you heard from Dr. King, what happens is that you have one case of measles, and you think about all the people they exposed, right? You think about all the people they exposed. They're in LAX. I was just in LAX this morning. So when you're in LAX, you can see all the people in the gates and the hallways and so forth. And now you got to find all of them. So you have to find who's been in LAX that time when that person's there. And then you got to talk to them. And then you've got to go and say, well, what's your immunization records? And I don't know how readily available you have your immunization records yourself. A lot of adults don't have them handily. So now you have to go dig them up and figure out. And then you have to say, well, by the way, we're going to follow you for 21 days to be sure you don't come down with the disease. So that takes a lot of manpower, it takes a lot of time, takes a lot of investigation. And so that's why that adds up. And you heard each exposure, I think Dr. King, you cited $1,000 to $2,000 per exposure, not per case of measles, per exposure. So you think if you've exposed 1,000 people, that at $1,000 a pop, that hits $1 million pretty quickly. So that's something that that's very expensive. So actually, I think yes, sorry, yes. Sure. Okay, so first of all, as you point, so first of all, in terms of what's appropriate and inappropriate, there's a lot of research on vaccines. So vaccines have to go a very extensive testing process before they are even approved, and even after they're approved, the Centers for Disease Control, and by the way, other public health agencies around the world, not just the CDC here in the United States. So clearly here in this country, the CDC actually tracks every vaccine and monitors for any potential negative problems that comes up that can be caused by the vaccine. And there's multiple systems, the Vaccine Data Safety Link. They look at actually medical records from large health systems and so forth to try and identify any problems. And then they create a table, a list, you go to the website of what they call precautions and contraindications to vaccinations. And so those are guidelines to physicians in practice, to public health departments about who should not get vaccinated, who should not be receiving vaccines. And so there is an extensive process of research that's involved to ensure that people are safe when they get vaccines. And in fact, even if there's any question that something might be a problem, they often end up in the precaution or contraindication list. Now, in terms of moving forward, so of course the challenge is, as I said, SB 276, the part where the public health department will be involved in actually approving the medical exemptions will take a few years to kick in. So what about now? We have a measles outbreak right now, right? And if 276 is passed, so the bill as it goes through, what we'll require is that all the medical exemptions have to be filed with the Department of Public Health. And the reason for that is that currently, if you go to a doctor and get a medical exemption, that medical exemption just goes to the school. So there's no database of all the medical exemptions being granted. And each school, because of privacy laws, cannot actually share who got the medical exemptions. So even though medical exemptions are really a public health issue, it's not being contained in the public health system. So what we're doing is we're also saying that now they have to be filed with the health department. Now, by the way, in law, a school cannot reject a medical exemption either. So even if a school principal or superintendent or school district board says, oh my God, we're really worried about our school here, they can't reject them. So one of the things that we also built into the bill is to say the health department, when they're filed with them, if they note that there are medical exemptions that are clearly fraudulent or inappropriate, they would have the power to revoke them. So they could go and say, you know what, there's a school, we have a measles outbreak going on in the city. These schools have really high exemption rates, and when we looked into those exemptions, we think they're suspect, and may talk to the family and say, okay, you know what, this doesn't really count. We're to try to bring up the vaccination rate. So there is a mechanism to try to address the more immediate issue, but clearly the long-term solution is to halt the fake medical exemptions by having physicians partner with the California Department of Public Health in being sure that inappropriate medical exemptions are not allowed in the first place. Well, so right now, actually, you can look up the rate of vaccination at any individual school, so that is public. Clearly, any information with a patient's name or so forth has to be kept private, right? So all privacy laws, federal and state, do apply to this database. Thank you. Yes? Well, certainly adults are more challenging. So actually, it's not that they wane as much as the fact that most people who were born before 1989 only received one measles vaccine. Well, let's put it this way. If you're born before 1957, you probably got measles itself. If you were born between that point in time and 1989, you probably only got one measles vaccine, because that's when the recommendation came out, actually because of a large measles outbreak here in Los Angeles. There was a large measles outbreak between 1988 and 1990, as well as in other parts of the country. They actually changed the requirement to saying that you should get 2 measles vaccines, which provides 98% protection. So if you only got one, you're about 91, 92% protected. So you have a 1 in 11 chance of getting measles. And if we weren't having active outbreaks, that probably wouldn't have been, that wasn't a big issue. now that we're having active outbreaks, people are expressing concern to say that, well, if you're an adult and you happen to be in a place where an outbreak's happening, even though you got that one measles vaccine, if you were born at that period of time, maybe we should think about getting a second one for that increased protection. But it is more challenging with adults, which is why it's important that we work to be sure that we get kids immunized in school. As I pointed out, SB 277, while it certainly is improving vaccination rates, it's not getting kids who are in high school and who are in college, like UCLA, like CSU LA, where they had people quarantined for measles. Those kids, we're not going back to them and saying that if you're not vaccinated, you need to get vaccinated. So that's still a potential issue. But if we actually keep outbreaks out, then that becomes less of an issue. Correct. So certainly there's going to be some additional cost to the Department of Public Health to actually conduct the review, but I would point out that cost is much less than the cost that we're experiencing right now, having to deal with all these outbreaks and trying to contain these outbreaks. So it certainly, I think it's a wise investment by the state. In West Virginia, actually, because what happens is that we basically eliminated the market for fake medical exemptions. The number of exemptions that need the review actually dramatically drops as well. Yes. It would be the California Department of Public Health would be working with physicians. So the physicians would submit the information, and then the Department of Public Health would be working with the physicians and reviewing them and then approving them. So as I said, this is a bill that's supported strongly by the physician community. We have the California Medical Association, the California American Academy of Pediatrics are the sponsors of the bill, along with Vaccinate California. So it's the doctors who say, we need this to happen. We want this. Yes. Wow. Well, some of them are, I've seen, they may be charging like $300, $500. Sometimes what they'll do is they'll say, well, I need to conduct some tests, and they'll charge large amounts of money for those tests, which have no relationship to vaccines. There's a whole variety of schemes they've developed to extract as much money as possible from these poor parents, these anxious parents. I know there's another physician we heard who will grant temporary medical exemptions, so they have to come back every so many months to get another one. They can charge them another bill. It is actually quite sad that some of these physicians really are, they're making money. They're just trying to take advantage of these parents who are anxious about vaccination. Instead of educating them and counseling them with accurate information, they're extracting as much money as they can. And by the way, they all charge cash, and many of them don't regularly take care of children. So they're just here to sell the exemption. And as I said, we've seen posts from people saying, well, my child's doctor doesn't want to grant a medical exemption, so where can I go buy one? So we know people are going around purchasing them, and people are selling them. It's not their child's regular doctor. So, yes. Well, the problem is that it's getting, each year we see an increased number of medical exemptions. So but more importantly, the challenge is that we're seeing schools with high medical exemption rates, which means that those schools are no longer safe. So the good news is that with SB 277, we have actually increased the immunization rate. In fact, it's been reported in the LA Times and other places that because of 277, even though it's only been in place for 2 years, that's why we haven't had such a big measles outbreak like other states have. That's a success, 277. However, the problem is that for that success to continue, we can't let rogue physicians basically erode that success. And that's what we're seeing. So we're seeing that medical exemption rate keeps creeping up each year. And so when that happens and you see schools with medical exemption rates of 20%, 30%, 50%, and as that continues to increase, we're going to be at risk for an outbreak again. All the hard work we put into stopping these outbreaks will be undone because we allow a handful of physicians who are interested in making money instead of protecting the public do so. And that's why we need the SB 276. Okay, well, thank you so very much. Really appreciate it. Thank you. Thank you.